What happened in Pakistan is these catastrophic floods in which we saw millions of homes destroyed, people became homeless, a lot of people's land was lost. And we just saw that one of the biggest casualties of this complex emergency was pregnant people and newborns. So we saw that women were just having to give birth in tents, they gave birth, some women gave birth in the water. It really led to making the maternal and neonatal health situation much worse. I mean, we saw infections, we saw maternal deaths. The, the sheer amount of tragedy that had happened, I think it's something that you couldn't actually understand until you were on ground. I wanted to understand what was happening and what it was that I could do in my capacity as a midwife to support these women.
फ्लड का एक्सपीरियंस हो चुका है यहाँ
3 फ्लड का एक्सपीरियंस 2007, 2010 और अब ये
अभी स्टार्ट हुई थी ना जो रेन फ्लड इमरजेंसी वो हमारे ओपीडी 5700 बेड और 64 था एबारन पी एबारन सी मलेरिया कम 100% मलेरिया केसेस 100%।
तो ये जो हमारा जो कैंप हम लगाना चाह रहे हैं कल और परसों के दिन वो बेसिकली प्रेग्नेंट औरतों पे ही फोकस होगा।
तो फरीदाबाद बीएचसी सेंटर मर्दनानी अस्पताल उत्ते अच्छे सुबह 10 बजे ठीक है ना बारन के पठे दो तो ना पे नड़े के खई वजा सही है
हम माई के पेट थे
आता मई आसो
आप पेट से
हाँ 4 महीना
4 महीने बस सही है आप आइएगा। हाँ
इसके बीच में लगाते हैं गाड़ी को ना हम लोग वो गाड़ी आगे हो गई साथ
है ना
So we needed to provide them with antenatal care. We needed to see if their pregnancies were okay. If they needed to get to referral sites, we needed to get them there, and we needed to prepare them for their births with clean delivery kits, so that if they end up giving birth in wherever they are, in tents, in their communities, they at least are still able to have a safe and clean birth. We were able to take out maybe close to 13,000 clean delivery kits in the areas. The estimated number of women who were due to give birth in these 2 months was around 75,000. So we were able to reach maybe around 20% of that population.
और ये बच्चे को रोज एक ड्रॉप विटामिन डी रोज एक ड्रॉप देना है ठीक है।
What we would see often, and some instances were much worse than others, was that the demand was much greater than supply in terms of what it is that women needed. At any given clinic, we can see maybe around 200 to 300 people in a day at full capacity, but at this day we maybe had more than 1,000 people show up. Because we weren't able to meet that need at all, there's a stampede. The people were not able to access services. A lot of them had come from really far and they went back without getting anything. I've been speaking to a lot of midwives at midwifery schools and engaging them and having discussions with them on how we could advocate for them better so that they're able to mobilize in future emergencies. But also sharing with ministries who may not know the kind of impact that midwives can have in these kind of disasters and humanitarian situations. So we've used it as a really pivotal advocacy moment to highlight what the gaps are and how the gaps can be filled using midwives as a solution.
फिर आप किधर गए?
हम रोड पे बैठे हैं।
रोड पे बैठे हैं। तो बच्चा कहाँ पैदा हुआ है?
वो रोड पे।
रोड पे?
हाँ।
किस तरह?
वो कपड़े टांग के मरी, कुछ भी नहीं था।
हाँ।
घर भी नहीं था।
घर भी नहीं था।
हाँ।
5 बस कपड़े टांगे।
हाँ।
और फिर किसने डिलीवरी करवाई?
मेरी सास है, उन्हें बच्ची है।
सास ने करवाई?
हाँ।
कैसे?
दाई भी नहीं है।
दाई भी नहीं थी?
हाँ।
सास को आता है डिलीवरी करवाने?
हाँ।
फिर कैसे करवाया उन्होंने?
बस इन्हें करवाई है।
ये नाल किससे काटा?
पत्ते से गिरे।
पत्ते से? और क्या बांधा उस पे?
धागा।
धागा।
हाँ। बन्या सराम से गुल्ली पेड़े खड़ी है।
बस हिकड़ी बहन बाकी रक्षो न जलते हो।
अदा दे रहे हैं।
We started this hospital to repair fistula, and then we started a women's hospital where we train midwife to deal with obstetric labor and provide basic obstetrical care. Any woman who come to this hospital, she will be welcome, and if she is pregnant, she will be booked in antenatal clinic. A midwife will see her, and midwife will look after her till 9 months. Then we have facilities for her to deliver their babies here. And if there is an emergency, we will operate on them. The other thing that it's a training center. We admit 140 midwifery students every year and train them to become a skilled trained midwives. I think we are giving good training to midwives to become good midwives, can perform normal deliveries, can recognize complications. This flood has a big impact. They destroyed the families. If you go and see the flood relief camps, which we are running in different parts, and our midwives from this hospital are going there every day. They are in the camps and they are giving them medicine, educating them about hygiene and healthy living, etc.
पर पहिरीं पंहिंजी इज़त कोन कंदव त केरु तव्हांजी इज़त कोन कंदो, कॾहिं कोन कंदो।
All our 85,000 villages in Pakistan, they don't have any skilled birth attendant. So they should have midwives. It is the government's duty to have massive program for the training of midwives. Pakistan needs 200,000 midwives. We have 35,000 midwives. The biggest challenge for the midwife is that government and the profession, and when I said profession, I mean obstetrician and gynecologist, they do not acknowledge a midwife. They do not understand the importance of the midwife. They are ignorant. This word is not hard, but if it is even hard, I will repeat it. The doctors are ignorant about the role of the.
Dr. Shesha is someone I think that it's hard to understand how someone like him exists. He's actually quite magical, the way that he works and the way that he operates and the way that he advocates in this really fearless way. It's actually extremely inspirational, and I hope that there can be more people like him. see frameworks being made, strategies being made, we see high-level plans being made for midwives, but midwives are absent from all of this planning. And if one of the things what we're trying to tell the government right now is that you will not be able to progress in midwifery if you don't invite midwives to give their input.
Challenges क्या है जिसकी वजह से लोग midwives community में अकेले काम नहीं कर सकते? क्या आप लोग कहेंगे?
लेकिन मिडवाइफ जहाँ तक मिडवाइफ इतना काम करती है तो उससे सहूलत मिलनी चाहिए। सहूलत नहीं है।
फ्लड्स हर जगह हो रहे हैं, इस तरह के जो इश्यूज होते हैं, कहीं और कोई डिजास्टर, कोई वॉर हो रही है, तो क्या मिडवाइफ का क्या रोल होता है इन सिचुएशन?
हमारे पॉइंट्स में जहन में ये पॉइंटें होती है कि हम किसी के लिए काम करें। जब तक हमारे साथ कोई किसी का साथ नहीं होगा तो हम कर नहीं सकते, क्योंकि आजकल के इस माहौल में हम लड़कियां अकेले जा नहीं सकती, कहीं ट्रैवल नहीं कर सकते।
अब आप लोग अपने 4 कोनों में बैठ जाएं, ठीक है? अपने इनफ जगह रखें कि कुछ आर्ट वर्क कर सकते हैं।
असल में सोच
पॉजिटिव सोचना है तब नेगेटिव सोचना। पंजे पॉइंट तो 12 वर्ष
कंप्लीट
मैं एक मिडवाइफ हूँ पर मैं अकेली हूँ। मैं एक मिडवाइफ हूँ पर मैं अकेली हूँ। मैं मदद करना चाहती हूँ पर मैं अकेली हूँ। मेरे पास पर है पर मैं उड़ नहीं सकती।
अगर मां उन्हनि खे सुठो मोटिवेट कंदासीं, हुन जी ज़िंदगी बचाईंदासीं, हुन जी बेबी ज़िंदगी बचाईंदासीं, त सुभाणे वरी ॿी पीढ़ी चवंदी वाकई असांजे ॻोठ में मिडवाइफ सुठी आई आहे ऐं असांखे वञणु घुरिजे।
The approach that I always take towards advocacy, and I have in this role as well, is staying very connected to midwives at the community level. A lot of policy work is done through a top-down approach, but a lot of people who do policy work have never spoken to a midwife in their lives. So a lot of our approach is getting midwives' voices out and being able to feed their thoughts and their experiences back into what it is, what is the change that needs to come into their work. आप डॉक्टर क्यों बनना चाहते हैं? आप मिडवाइफ
में इस पोइट्री मिडवाइफ के लिए हमें बहुत है दम, हम नहीं किसी से कम, बल्कि हम बहुत छोटा दोबारा ये तो अभी भी बहुत है, और वही हम कहते हैं अभी दादू से हम आए।
I love being a midwife because there's so many reasons. Like the messiness of human life, I like that, but also love being a part of the magic of birth, and being just working with families through this really like complex emotional time where they have babies, or even a lot of it is related to loss and grief, and just being present in those moments has just been really, really special.
अभी दर्द हो रहा है? काली छोटी वाली 3 जो है।
We need to change how communities see midwives. We need to gather community support for midwives. We have to start by giving people understanding that there's a healthcare provider who works with you, who provides respectful care, who will be there through your birth, and she is a midwife.
यार तो वीरे डावनी ना सूजी में वनी के
One of the communities that I work with and is very close to my heart is this island called Baba Island. Baba Island is a set of islands off of Karachi. We access it by boat. It's a 15-minute boat ride away.
The main 3 islands that we look at in terms of infrastructure and just general services that are just very basic, like education and health. There are lots of children that don't go to school. There's no maternity care system in all 3 of these islands. If anyone needs to give birth, either they'll give birth with a traditional birth attendant, or they have to go to the city.
So I work there, I provide antenatal care.
अच्छा ना, कोई जगह तो आपको मिलेगी अच्छी जहाँ सेफली डिलीवरी हो ना, इस तरह तो नहीं मौलाना वाले में नहीं सकते। क्यों रो रहे हैं?
सब बीमार है घर में।
नहीं तो देखिए, आपको तो सिर्फ वहाँ पहुँचना है ना, बाकी तो सब हम कर। But there's a lot of work being done for advocacy to have midwives in communities, because the presence of a midwife just means so much more. So it's a cost-effective solution. She's a community-based health worker, so she's in the community. If she's in the community, then she is able to support people who are around her. क्या होता है आपको? ये आप या तो सुबह या रात को खाने नहीं पैसे नहीं देते।
I would say that I care about, as much as I care about midwifery and maternal health, is just animal welfare. The way that I can connect with women that I work with families, it's the same way that I feel like I can connect with other creatures as well, and that's why I feel like I just care so deeply about the dogs that are around us, or the cats, or the animals that need help around. It's related to empathy, you know, it's just related to like feeling deeply. So this is a pack of dogs that we've just known. Now I've known them for more than 4 years. So many of them have grown up in front of me, so many of them have been born in front of me, so many of them have died in front of me. And this pack has just kind of been such a big part of my life. So we're here every Sunday, we feed these dogs, they wait for us, and it also kind of, I think in all of this chaos, it also helps ground me to know that, you know, this is something that will be there when I go back on Sunday. My dogs will be there, they'll be waiting for me, we're going to feed them, and all is okay in the universe.